Hello, welcome to ANA community. In this particular video, we are going to discuss about the one word that a student of Roga Nidana has to be familiar with. What is that particular one word? And the word is and the word is Rogamarga. So, what actually Rogamarga is actually, so that is the having the two words Roga and Marga. So Roga in the sense any kind of the discomfort present in the body, and Marga in the sense the where this particular discomfort are being observed, which particular part of the body is being observed. Is these discomfort can be relatable with one or the other. So that is what we can say. The identification of that is considered to be very important when you want to uh, learn this particular subject deeply. First of all, let us have the three different presenting complaints here. So here, three presenting complaints were being observed: vomiting, itching, and knee joint pain. First of all, whenever if you think about it, so there are certain around the uh, 8, 7 points are there here. So how we are going to look into that particular part in each of these particular presenting complaint has to be known. Then only we can able to say that the how the this information will be helpful in moving further. So regarding the first information, how to get the information regarding this particular lakshana or presenting complaint. Vomiting is a different complaint. Itching in the skin is a different complaint. Knee joint pain is a different complaint. This may be observed in three different individuals. This may be observed in one individual itself. So in that particular sense, so we have to know about how to get the information as such. So that means we are going to interact with the patient, what we can say the Prashna Pariksha or Aptopadeshika Pariksha we are going to do, or we are going to analyze that regarding the history related to this vomiting or itching in the skin or the knee joint pain, etc. So regarding the onset, duration, severity, aggravating and relieving factors, and regarding the dosha dominance assessment, etc. So that is we can analyze this only by the proper history itself. What the regarding the uh, duration of the presenting complaint, regarding the uh, whether which particular complaint has been occurred first, whether is it knee joint pain or itching in the skin or vomiting, etc. So that is the basic idea to look into that particular aspect that is coming under the purview of a Roga Nidana. And type of the Nidana taken by an individual. So that is what type of the Nidana the person is taking. For example, vomiting in the sense the person might have taken some kind of the spicy substances, or the person may be having some kind of the early pre-existing complaint as such. For example, pain in the lower abdomen, probably the constipation may be there. Because of that, the person may be having this particular the vomiting as such, and itching in the skin. In this which particular part of the skin the person is having itching, whether is this related to some kind of the, for example, if it is present in the palm, whether the person is using the washing powder or that is leading to this particular itching as such. Or when you think about this wearing this any kind of the bangles or the ornaments, so around the neck as such, wearing the necklace maybe the might be the possibility, or in the hand wearing the bangles, that may be a possibility of this particular itching in the skin. So like that type of the Nidana, what type of the Nidana is going to do that, that will be deciding that. In case of the knee joint pain, whether the person is doing the excessive walking or running as such, or sleep or sitting for a longer amount of time, where those are the Nidana, that is what type of the Nidana is going to be taken by that. Whether the person is going to take only one Nidana, or 2 or 3 or 4 Nidanas as such. For these, you need to know about the what type of the pathogens as such, what we can say Nidana as pathogen. What type of the pathogen is going to exposed by the individual has to be known. Whether what type of the source of the, whether is it which particular Bahya Srotas is being afflicted, that has to be known. Which particular Abhyantara Srotas affliction is there, that has to be known. So like that, the combination of the Nidana, that has to be analyzed there by the learner as such. And after that, Lakshana of the organ observed. For example, here let us take the 3 examples itself. So vomiting as such. Whether the person is having the vomiting in the sense the organ afflicted could be amashaya, or otherwise what we can say the stomach may be afflicted there. So we need to know about how to identify that, whether is there any pain abdomen in the gastric region is there or not, or regarding the what type of the color of the vomitus, whether is it considered to be having the undigested food itself, probably pyloric obstruction may be the cause, or whether the color of the vomitus is showing the yellowish coloration, so that may be indicative of a second part of the duodenum that may be afflicted, or whether the person is having the dark the black coffee ground vomiting acid, there may be a possibility of bleeding in the stomach as such. So like that, the lakshana, depending upon the lakshana, we can able to analyze the cause as well as the organ afflicted. Let us take the itching in the skin. When you are observing itching in the skin as such, we are going to say there may be a possibility of twak or skin that may be afflicted. And regarding the what type of the nature as such, whether is it around the neck as such, probably the may be a possibility of exogenous factor may be observed. Whether the skin is the itching in the skin all over the body is being present, some kind of the endogenous cause that may be the cause for this particular itching as such. Knee joint pain as such. So here the organ afflicted could be knee joint only. So we need to concentrate upon what might be the possible causes of affliction of this knee joint, that has to be analyzed. Based on that, how to identify the organ afflicted? So that is by proper Rogi Pariksha and Roga Pariksha. In the sense, we need to identify the exactly regarding the all these different pariksha that are being told in the as the Ayurveda aspect, that has to be known. Regarding the Roga Pariksha as such, what might be the possible Nidana, or whether is there any Pura Rupa is being present, or is there any Rupa is being present on that particular region, or what are the measures that are going to improve or worsen the situation, and how we are going to identify that the pathological events, or what we can say the samprapti, that is coming under this particular the Roga Pariksha as such, related to organ identification, organ affliction identification. As far as Rogi Pariksha is concerned, we need to know about the Aptopadesha Pariksha. So that is how we are going to get this particular information related to that particular presenting complaint as such, regarding the Pratyaksha Pariksha and Anumana Pariksha. All these has to be incorporated in identifying the organ afflicted. And sometimes you need to use the yukti also, regarding the what has happened in the past, what is happening now, what can happen in the future. So that has to be analyzed. Then we need to identify the Indriyataha Pariksha. We have to use our eyes, we have to use our ears as such, or we have to use our nose, or the our sparshana, or what we can say the use of the touch sensation of the clinician has to be used. And further, we need to identify the different body parts, for example eyes or tongue, or the perception of the sound as such, or voice. And we need to know about the what is his mala pravritti as such. We have to inquire about the color of the mala as such. So all these aspects, plus we need to identify the Dashavida Atura Pariksha in terms of what is the his prakriti, what is his sara. In terms of, for example, prakriti, if the person is having the what do you say that vata prakriti, and he is having the knee joint pain, So probably that may take a longer amount of time for getting the improvement in the symptoms as such. So like that, the Sara, whether the person is having Astisara Pravara, in the sense knee joint pain as such, that may require much less amount of the time to get the complete remission of the symptoms. And some manana, what is body, the what do you say, that the composure as such, in the sense, so we need to know about the regarding his muscle bulk, etc. And pramana, what is his anthropometric measurements as such. Then what is his mental status, sattva, ahara shakti, what is his ability to take the food as such, whether he is able to the consume the food adequately, or all these consumed food, whether that is being digested properly, that has to be inquired. So all these aspects to identify the organ afflicted, these informations may be helpful. How to identify the Rogamarga afflicted? In the sense, whenever if the person is presented with vomiting, we are going to say that there may be a possibility of Abhyantara Rogamarga affliction. If the person is having the itching in the skin, as such, we are going to say that the person may be having the Bahya Rogamarga affliction. And if the person is having any joint pain, we may say that there may be a possibility of a Madhyama Rogamarga affliction. So, like that, this may be observed in a single individual. This may be observed, these three complaints may be observed in three different individuals also. Depending upon that, we are going to identify the Rogamarga affliction there. So, and how to determine the prognosis as such. So, these are multifactorial. When you think about that, regarding the duration of the presenting complaint, may be helpful in determining that. More the duration of the illness, that takes more amount of time to get it cured. Or this may be helpful in noting about the number of the Nidana Sevana as such. Number of Nidana Sevana are less, the recovery from the illness may be faster. Number of Nidanas are more, then recovery from the illness may be lesser. Then virulence of the Nidana as such. If the virulence of the Nidana is very severe, very potent, then that may require more amount of the time to get the complete remission of the symptoms. Or if the virulence of the Nidana is very less or the very mild, then even though the person is going to consume the large amount of the Nidana, the person may have little amount of the or mild form of the treatment to get the complete remission from the symptoms as such. So like that, the prognosis will be decided by the multiple factorials. Suppose if the person is having, based on the Rogamarga, the concept itself, if one Rogamarga afflicted, it is easy to cure as such. So that is, we have to identify which is the the elimination of this particular pathogen, nearest possible elimination. Based on that, we can able to give the treatment properly. Suppose when you think about the vomiting as such, in that particular situation, the already elimination is happening through the mouth. So depending upon that, if the person is having that particular aspect, then we have to look into that, whether is it beneficial to him or harmful to him. How far it is beneficial to him, based on that, we have to give the treatment as such. Whether is it the possible to remedy the symptoms as such, that has to be known. And regarding the itching in the skin as such, if it is local, in the sense the possible elimination will be through Rakta Mokshana, or what we can say bloodletting can be done, or otherwise the local application can be done. Or if it is the widespread lesion, then Rakta Moksha is not possible from all these areas. In that particular situation, we may have to bring those the presenting the pathogens present all over the skin, that has to be brought into the interstitial compartment. From there, that has to be brought into the intravascular compartment. From there, that has to be brought into the alimentary canal. From there, that has to be eliminated either through Vamana or through Virechana, or through Basti, depending upon the nature of the presenting complaint as such. Let us say the third presenting complaint, that is knee joint pain. When you think about the knee joint pain, so in this particular occasion, we are going to say that there may be a possibility of Madhyama Rogamarga affliction. So here, what can be done to have the remission of the symptoms in this particular occasion? Maybe the local application, maybe the snehana or oil application, or the poultice application as such. Or if there is multiple joints are being afflicted, then also it is not possible to give the treatment to all those joints afflicted. In that particular situation, we have to make that the pathogens to move from those afflicted joints into the interstitial compartment, from there intravascular compartment, from there to the alimentary canal, then that will be eliminated. In that way, the determining the prognosis, which may helpful in giving the adequate line of management as such. So in total, when you are knowing about the all the informations related to Rogamarga, then we can say that there you are learning this particular the subject of Roga Nidana very well. Dear community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below, and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.